Kansas and Missouri have been dealing with a shortage of dentists for at least 20 years.
So in this To America's report, Megan Abundis explores the health crisis for people who can't find dental care.
And how a local group is working to solve the problem.
All doctors are not alike. It's still as much an art as it is a science, so once you find a doctor that works good with you, you don't want to switch.
Bill Jackson sums up finding a dental provider with this. He wants others to know the challenges of finding dental care with federal health insurance.
I'm just not finding anybody who's taking it right now.
According to the American Dental Association, only 36.6% of dentists accept Medicaid in Missouri. In Kansas, it's 39.7%.
Like you're left behind, kind of. Basically, I just do without until something actually crops up and I have to deal with it.
So today we will be taking some impressions.
Dr. Anthony Jimenez says regardless of insurance status, he wants to provide quality health care.
Now I want you to stretch really wide open.
And be a place where people can land.
More offices should and have an obligation to help marginalized communities.
Jimenez says about half his patients have Medicaid. The others pay on a sliding scale. His community health center is funded through donors. He knows not all private offices are like this. And when you add in staff shortages, he wants to make sure patients don't slip through the cracks.
Nationwide, we see a shortage of healthcare providers in the dental field.
The federal government tracks this problem with a database called Health Professional Shortage Areas in 3 categories across facilities, areas, and populations. In Kansas, 94 out of 105 counties have a shortage of dentists for at least one of these categories. In Missouri, all but 2 counties have one of those shortages, amounting to 1 dentist for every 5,000 people. In Wyandotte County, where Dr. Jimenez works, there's a shortage of dentists for the low-income population. He says getting patients in the chair comes down to trust.
Folks that look and sound like them.
Patients are 4 times more likely to go to a dentist that looks like them. And in return, dentists are 4 times more likely to serve in an underrepresented population.
With that in mind, GEHA Solutions is sponsoring scholarships to get more future dentists. Like UMKC student Eze Chiaka in the field.
Dental school has its challenges. It wasn't always my first choice.
Chiaka didn't see a dentist until he was 26 years old.
I wasn't raised in a dental home.
And that's why he wants to drive change in the industry.
The only way we can bring that trust is when someone that looks like us speaks that trust to us. Downstairs at the clinic where we work, I notice it all the time. When, being it a Latino, being it an African American, being it a person of color that walks through the door and they see someone that looks like them, that welcomes them, it changes everything. They are much more free with you. The patient-doctor relationship is much more stronger.
With these scholarships, UMKC and GEHA Solutions are trying to shrink those dental shortages.
The need for support is actually very glaring.
In turn, helping people like Jackson, who got free care for a broken tooth through these students.
It took me about 3 weeks to get it taken care of, being without having a dentist to go to.
Because dental health is critical to overall health.
1 ounce of prevention, is worth a pound of treatment.
In Kansas City,
Take your tongue to the roof of your mouth.
I'm Megan Abundis, KSHB 41 News.